Our cancer screening guidelines were due for an update after Dr. Ernie Hawk came to MD Anderson as the new division head of the Division of Cancer Prevention and Population Sciences. He had a great deal of interest in us expanding our guidelines past recommendations for average risk individuals to also provide recommendations for individuals that are at increased risk of developing cancer. First off, in addition to adding recommendations for individuals at increased risk, we have also identified not only an age to start cancer screenings, which has commonly been part of guidelines, but also an age that maybe we need to consider stopping cancer screenings. So the areas of increased risk that we have identified for colorectal cancer are individuals with a personal history of adenomatous polyps, individuals with a family history of colon cancer, and those with a personal history of inflammatory bowel disease. What this clearly says is that you need to have a good understanding of your own personal health history and family history to be able to give this information to your clinician so that they can determine which category is most appropriate for you. One of the most common things we see when individuals come into the clinic is they will say, yes, I had a polyp found on a colonoscopy and it was benign. They don't know what type of a polyp it was. There are different types of polyps. In general, two categories that we look at: hyperplastic polyps, which are not associated with an increased risk of developing colon cancer and would not put them into a high-risk category. They may still follow the average risk recommendations of a colonoscopy every 10 years, even though they've had a hyperplastic polyp. However, individuals with an adenomatous polyp are considered at increased risk. Although the polyp is benign, these are the types of polyps from which colon cancers can arise. And having developed one adenomatous polyp, that individual is at increased risk of developing other adenomatous polyps. They thus need to be on a more frequent screening interval. Instead of being allowed to go every 10 years, they would be screened commonly somewhere between 1 and 5 years, depending on the number and size of adenomatous polyps that were found. So it's important for an individual to start getting more information about the findings on a previous colonoscopy so that that doctor or other doctors can make a good decision based on the correct information.